Hi, sir. Mr. Kashif, I want to know about how supply chains are more important in healthcare industry.
Thank you for inviting me for this talk. Like for me, supply chain is very important for the healthcare industry, especially post-pandemic or before pandemic also. The healthcare professionals or the healthcare profession itself is called the first line of defense by most of the countries. So if you see in the healthcare industry, the most important because it's a life-saving profession. So supply chain has more importance in this profession itself. Now if you start from procurement or logistics, so it is important to have all the medicines or the life-saving drugs or the life-saving equipments in hand. Most of the equipments are not made by one country, it is scattered around the world, sometimes from the Far East and sometimes from the Western world itself. So the supply chain company or the supply chain professional within a healthcare organization has to be pretty sure what are the requirements and what are the needs of the hospital or the entity or the organization which he is working, to make sure that he has all the supplies and he is able to meet the mandate of the government itself at large or the mandate of the population itself. So that's why for the procurement, supply chain is very much essential. Now if you talk about the knowledge is 100% essential. Certification, it varies between if they want to do the certification or not, but knowledge is essential. From where you are going to source, what is the quality of that sourcing, whether it will suit this part of the world, whether the temperatures are valid for that kind. For example, for vaccination, there is a particular requirement and it has to be kept in certain temperatures and everything. So we have to see whether we are able to store and how much we are able to store. What is the lead time required, how much we can purchase, because every government has the restrictions on the budget. So all the government have to think that, okay, we can go for with this one because medicine is one part, healthcare equipment is one part. Okay, so you need heavy equipment or you need the life-saving equipment, so that is a different prospect. So the government always look into having a proportion of each and everything. It's not like one thing. So that's why for supply chain is very important. If you look at the HR profession itself, in the HR also, they need to source based on the conditions or based on the requirements of the country. They have to source the doctor or healthcare professionals. Now while sourcing also, it is similar to supply chain, that you are taking a source and you are selecting a doctor, you are interviewing him, so you have to see whether this doctor, whether we can really take him on board, whether he is pre-qualified based on and at par as the requirements of this part of the world or any Middle East country or any other country itself, whether he will be able to speak or communicate to the patients or the larger population of this part of the world. So we have to see how much learning comes. So the HR professional, the supply chain is very much important, because he is also taking care of one aspect of the organization or the healthcare system of the country where he is procuring a healthcare professional. He is making sure that he is qualified, he is able to communicate in this part of the world. He will be able to be on the board in this part of the world also, or in Middle East or anywhere in the countries that climate suits him, whether he will be getting, his children will be getting the education, because it's not easy for that person to relocate also. So the HR profession will be doing all those things which a procurement manager is doing for making sure that he has all the procurement and supplies for healthcare professional. So equivalently, it is important for the healthcare profession, the HR professional also, to make sure that the doctor come or the healthcare professional comes. If he is not at par, so to make it par, which is a talent management job, and to make the learning curve as short as possible so that he can see the patients. Okay, and then to take care of that employee. So it is almost the logistics part and the inventory part. So I will not say that it's a human inventory and a human capital inventory. So we are investing in that part of the thing. Similarly in the finance also is sourcing the same thing. He is making sure that he has all the funds to pay the salaries, to pay for the equipment, to pay for the government, because these are non-profit making organizations. Mostly the healthcare sector is a non-profit or a simple profit, even if it is a private sector, but their major aim is to save the lives of the people. Okay, so there also they have to make the sourcing way available and to keep the hospital in the ongoing way, on the ongoing concern. Otherwise the hospitals will not be able to function. So supply chain is equally applicable to all major processes of a healthcare industry. So that's my point of view.
Yeah. Thank you, sir.